After experiencing some pain in my hip, my healthcare provider recommended I do a 3-phase rehab program, and this is phase 2. Leg strengthening exercises begins phase 2. Perform each exercise with minimal rest in between. That is 1 set. Repeat each exercise for a total of 3 sets. Side lying hip abduction. For the starting position, lie on your uninjured side with your top leg straight and your top hip rolled forward. In a slow and controlled manner, lift your top leg in the air, leading with your heel. Hold for 5 seconds and then slowly lower it. Use an elastic band if you want to increase the difficulty. Single leg wall reach. Stand 3 to 5 feet away from a wall and balance your injured leg, keeping a slight bend in that knee. Keep your back leg straight and hinge at the hip to bend over toward the wall and kick your uninjured leg straight back behind you. Briefly pause for balance and then slowly return to the starting position. Repeat using the uninjured leg. 1 rep consists of both sides. Hold a light 5 to 10 pound weight in your hands if you need to make the exercise more challenging. Step ups. Stand next to a low step about 3 to 6 inches high with the foot of your injured leg on top of the step. Step up on the step using your injured leg. Pause briefly before slowly returning to the starting position. Use a taller step only if you feel no pain and you can keep control and balance your body weight throughout the entire exercise set. Walking lunges with hold. Stand with your feet hip width apart. Take 1 exaggerated step forward and lower your body by bending your knees until the back knee is 1 to 2 inches above the floor. Hold for 5 seconds. Step forward, alternating legs throughout the set. Add time to each hold up to 10 seconds to make the exercise more challenging. Phase 2, core exercises. Perform each exercise with minimal rest in between. That is 1 set. Repeat each exercise for a total of 3 sets. Glute bridge march. Lie face up on the ground, knees bent about 60 degrees with your feet hip width apart. Lift your hips off the floor, pushing through your heels and squeezing your glutes. Lift 1 foot slightly off the ground and hold it for 3 seconds. Alternate sides in a marching fashion. Do not overextend your back. If you feel strain in your back, lower your hips a bit until you feel your legs and glutes take control and hold there. 1 rep is both legs. Add time to each hold up to 10 seconds to make the exercise more challenging. Plank. Lie face down propped on your forearms, with your elbows under your shoulders and legs extended straight. Lift your hips off the ground, creating a bridge from your forearms to your toes. Keep your abs tight and your back flat. Add time to each hold up to 60 seconds to make the exercise more challenging. Side plank on knees. Lie on your side, propped up on your forearm with your elbow directly under your shoulder. Bend both knees so your feet are behind you. Lift your hips off the ground, creating a bridge from your forearm to your knee. Keep your abs tight and your back straight. Switch to the opposite side before moving to the next activity. Add time to each hold, up to 60 seconds to make the exercise more challenging. The key is low-impact activity that doesn't cause pain in your hip. When you proceed to impact running, do so for a maximum of 3 days per week, with a day of rest between running days. As a general rule, don't increase the volume or intensity of your cardio exercises more than 10% per week. If your hip pain increases, scale back to running to 1 to 2 days a week at a lower intensity. You may use the rower, bike, elliptical, or pool for the remainder of your training days. If pain continues, see your healthcare provider. Stretches, Phase 2. Perform each stretch for 30 to 60 seconds, and remember to rest in between each stretch. Self-massage, quad. Lie face down on the floor with a tennis ball, foam roller, or similar object under the thigh of your injured leg. Support your body weight with your forearms and toes, moving up, down, and around the thigh. Try to relax your body, especially the thigh you're rolling. Give extra attention and time to areas and the muscles that feel sore. Standing quad stretch. Stand on your uninjured leg and hold the foot of your injured leg or loop a towel around that foot. Keep your balance and press your hips forward by squeezing your glute muscle, slowly pulling the foot or towel behind you until you feel a stretch in the front of your thigh. Lying glute stretch. Lying face up on the ground with both knees bent, cross your injured leg over the other, resting the ankle on the opposite knee. Keeping your back flat, grab the thigh of the uninjured leg with your arms and pull it slowly towards your chest. Lying hamstring stretch. Lying face up on the ground, grab the back of your thigh or loop a towel around the foot of your injured leg. Keeping a slight bend in the knee, slowly lift your injured leg into the air using your arms or a towel for support. You should feel a stretch in the back of the thigh of your raised leg. After 3 weeks of phase 2, I'm feeling a little bit better, so I'm ready to move on to phase 3.